My name is Dr. Smithson. I'm in practice outside of Washington, D.C., Northern Virginia. I've been doing this now 17 years, having a blast every day, doing something I love, which is a lot of fun. I didn't really have vision correction needs as a kid, or at least I didn't know I did. So it was always just sort of understood that I saw things as well as I needed to. Until I went off to college and felt like, still I was fine. Played, collegiate soccer through the University of Delaware. Was always an athlete that, played it at a pretty high level, so I always assumed that I was fine. Went to optometry school and kind of found out that I wasn't. That kind of led me down the road of really appreciating vision. I've taken it there to now be a part of this wonderful group practice, which I've been in since I graduated from school, so 17 years here. And for me, it was annoyance. I was so annoyed with listening to people tell me how wonderful laser surgery was. I was a recent grad. I was sitting, in here seeing patients every Saturday morning, coming in with their one-day post-ops, and I had worn my glasses, I wore contact lenses, and I had astigmatism lenses and such, and and I was sitting there rubbing my eyes and itching my eyes, and it was driving me bananas. And I'd sit there and say, well, how was your surgery yesterday? How do you feel? And people were smiling and happy. This is the best thing I've ever done. And I thought, what am I doing? This is bananas, And again, I think it was also part of the understanding of seeing these patients, seeing the quality of work, and everything be flawless, and having these great results, and having these happy patients that led me to the phone and said, okay, let's sit down and talk about this for sure and get this thing done. And again, I tell people every day that I would do it again in a heartbeat. It was one of the best things I've ever done. It's a quality of life difference with, as dynamic and busy as my lifestyle is, and not dealing with glasses and contact lenses. It's just a really liberating and easy day. And I would do it in a heartbeat, and I tell every patient the same thing. For me, my patients, myself, TLC was the only choice.